Hello and welcome to this Health Suppliers segment on Health Professional Radio. I'm your host, Neal Howard. Glad that you could join us. Our guest is Mr. Alex Forrest-Hay. He's Vice President of Population Health at Metabolon, and he's joining us on the program to talk about a recent announcement that Metabolon is going to be providing profiling for the U.S. Veterans Administration's Million Veteran Program. Welcome to the program, Alex.
Thanks for the invite, Neal.
Great. So before you were VP at Metabolon over the population health segment, what were you doing?
I worked in the genetics field for about 20 years. So previous to joining Metabolon at the beginning of last year, I worked for a company out of the Bay Area. This was called Affymetrix, that did gene expression profiling and genetic work for the research and diagnostics community. And, the reason I moved to Metabolon is that we're actually, at Affymetrix, we were involved in some of these groundbreaking programs like the Million Veteran Program. Mm-hmm. And the next step of a lot of these programs was moving into the metabolomics, which Metabolon is an expert in. So my background is very much on the genetic side, but I've had a sort of 20-year career working in that field after I did my PhD working on brain cancer.
The Million Veteran Program, what does the program entail, and what does it hope to uncover through the use of this technology?
Yeah, no, it's a really incredibly ambitious program that the VA put in place about 6 or 7 years ago now. And what they're doing is they're collecting biological samples from veterans who are part of the VA healthcare system. Mm-hmm. And so far to date, they've collected about 650,000 samples from the VA healthcare system. And one thing that's great about the VA system is that obviously they have all the electronic medical records for these patients, and they understand their health, and they care for them throughout their lives. So they have really great longitudinal data about each of these volunteers' health. So the idea of this program is to collect the biological samples and collect genetic information about each of these participants, and then also other types of molecular information like metabolomics, so that the real goal of the program is to ultimately understand disease progression, try and be able to diagnose disease faster, and also provide better information for interventions, such as the correct drug to give at the correct time within a given person's health journey. So it's a really incredible program. They're obviously planning to recruit 1 million people. Right now they're 65 or nearly 70% of the way there. And it's a very exciting program.
So the VA is moving toward tailoring care for each veteran based on so much more than just blood tests or diagnoses or x-rays and things of that nature, down to the very genetics of each patient. And now, once they have 1 million veterans enrolled, is this something that they're going to roll out? Is it going to be something ongoing, or are they going to stop and try and analyze the data that they've collected?
Well, it's a little bit of both. They plan to continue recruitment, and they'll continue beyond 1 million, provided that obviously the VA funds such an initiative. But the overall goal is actually to create a sort of an engine inside of the VA healthcare system that can combine all of this molecular information together with the electronic health information, so that they can help with all the veterans and diagnose diseases better. I mean, one example would be, if you think of your health as a journey where your genetics is kind of the start of that journey, right? And along that journey, you may go on to develop diabetes, or you may go on to develop chronic kidney disease, or some kind of ailment. Now, by having this information, you're actually going to be able to actually track that individual's journey throughout their healthcare plan, and actually be able to make far quicker diagnoses and ultimately move to a kind of more preventative healthcare system away from the current sort of reactive healthcare system we have today.
What do you see as far as applications in the civilian world? Is that what we're ultimately going for, is to even be more efficient and use this as a kind of a test maybe?
Yeah, I think that's exactly right. And I think within the VA system there's certain ailments that are more common than in the normal population, things like post-traumatic stress and, certain diseases that really manifest themselves within that population. Mm-hmm. But the Million Veterans Program is also part of a much broader initiative, an NIH-funded initiative, which is called All of Us, which you may have heard of, where they're collecting essentially healthy individuals from the general American population. And I think this type of program is actually happening all over the world. And the idea is that if we create enough data and enough information, we'll be able to actually apply this to healthcare systems all over the world. So this should have an impact on every individual within America and also globally.
Now, I thought I heard you mention that other entities that are conducting similar research are getting data from healthy patients.
Yeah, that's correct. Yeah, so one of the pioneering programs in this regard is in the UK. There's a program called the UK Biobank, and they collected essentially 500,000 samples from healthy individuals, and again getting their genetic and metabolomic information and other forms of molecular information. And then these people will obviously grow old ultimately, and some of them will grow sick, and they will all ultimately die. And so what we're going to be able to do is actually over time track this progression and see if we can understand the sort of evolution of those diseases. And for some diseases such as Alzheimer's and dementia and diseases such as this, it's going to be really critical to see if we can track potential biological markers that could give us early prediction of a disease like that, and then we could treat them much earlier. And there are healthcare economic benefits to that, as well as obviously the benefits to the patients.
Well, I just wanted to be clear that this type of testing and research wasn't only being conducted in a hospital situation where people are more likely to have an injury and illness as opposed to just across the board, general population. So I understand now that we are collecting from those who are ill mentally and physically, and those who show no signs of any type of illness, but we are tracking them on a genetic level nevertheless.
That's correct. Yeah, and that's absolutely correct, and not just at the genetic level. I think, as I said before, the genetics is kind of the start of the journey, and what metabolomics actually helps with is it kind of creates the roadmap to any given outcome. So if you're healthy, the metabolomics gives you the sort of the road that's led you to a healthy outcome. But if you get sick, you can also track that road back to the genetics and see whether there's some kind of predisposition to that, and also whether you can intervene earlier to prevent that in the future.
Now, obviously, in the VA system, there are a lot less younger people and children as opposed to in the civilian world. Are these tests being designed to include all portions of the population?
That's a great question. I mean, with the VA is a kind of very specific population, as you pointed out. So 90% of the people are male. Most of them are, over 50 who have enrolled in this program. So there are similar initiatives, not through the VA, but through other funded initiatives looking at birth cohorts and tracking those cohorts of individuals through their lives. So there are programs in place now to actually gather this information at birth and then strategically at points along their journey through life, so we can actually track this in a longitudinal way. So there are programs that people can enroll in that also do that.
Well, where can we go and learn some more online about the VA's program and about your organization as well?
Yeah, so the VA has a really nice website with information on the Million Veterans Program specifically, which you can, I don't have the link in front of me, but you can certainly find that with a Google search. And I would also encourage people to look at the Metabolon website and some of the sort of diagnostic elements of what you can diagnose with the metabolomics technology, which is very, very interesting. There's some nice case studies in there about how people have been diagnosed earlier with some of the diseases that they have. And other good sources of information are the UK Biobank has a website that is available to all to access how they're running that program and making that data available to the general public so they can understand their health. The ultimate goal of all of these programs is for each individual who's involved to actually take control of their own healthcare in a manner that will enable them to understand it and track their progression throughout their life. And I think that's where we're heading. Is a revolution in healthcare is coming down in the next 15 to 20 years. We're going to all have much more control over our own healthcare destinies, and these programs are going to be essential to get to there.
Thanks so much for coming in and sharing with us today, Alex. It's been a pleasure.
Thank you very much for having me, Neal.
You've been listening to Health Professional Radio on this Health Supplier segment. I'm your host, Neal Howard. Transcripts and audio of this program are available at hpr.fm and at healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm.